But what we were able to do, working on a Northwest footprint and on a network footprint, was actually identify what the priorities were. So all our programmes, although we sit in the Cancer Network, are across disease groups. My background is mental health nursing, and I've worked for many, many years prior to this role in dementia services. So I had some really good stories, but also some awful, awful stories about the care of people with dementia at the end of life. And that was the case kind of across the board really, not just in dementia care, but kidney care, heart failure, etc. So there was a real need to really think about how we position some of this work. The programmes of work have been historically and continue to be to a degree very health focused, health professional focused. We're now starting to broaden that out and think about how our colleagues in social care who have a really fundamental role to play in end-of-life care. But running parallel to that, of course, was and continues to be a great need to work with the public, and we are the public. So that kind of we are the they comes to mind. We're in our professional roles, but also we need to think about this from a public health perspective as well. And what became obvious to us as we started to develop our investment and training plan was the challenge of actually working with health and social care professionals, some of who were attending training sessions around end of life but actually were scared themselves of it. And so the barrier of actually engaging them with their patients and family groups were very obvious. They didn't want to do that. It frightened them, it worried them, they were opening this can of worms. So whilst we made our connections, and Mary was a key connection, the Dying Matters, as Elaine's already articulated, a very, very important lever in getting this word out, the Conversations for Life programme, it kind of, they became and are very much intertwined. So running parallel to the health and social care training programmes, which we have a strong commitment to, we've been very fortunate with funding. That has made a huge difference. But the important message around running sort of this public health approach, running parallel to those professional training programmes, to me is an absolute essential, because it is about empowering us and them as members of the public to ask about advanced care planning, to ask about what's going to happen to me. And I think we're starting to see that sea change. And what does make a difference, of course, and all the programmes, the Dying Matters, you'll see from the compendium some fantastic ideas about reaching out and some very creative ways, bucket lists, tea dances, you name it, they've happened for this last Dying Matters week. The Conversations for Life programmes, people were asking for more, the phone was red hot. We've been to a training session, can we have more, will there be more on? From GPs through to healthcare assistants, social workers, whatever that might be. So I think, and one other thing that I hadn't mentioned was the St Christopher's Schools project, which across the Northwest and in Greater Manchester we've had hospices engaged with that who continue to do that, where children from a primary school age up to kind of high school engage with the local hospice on a 4-week programme of activity, which is very focused on storytelling. But it is about grounding it and positioning it, I think, in a way that people have the confidence, they have the competence as health and social care professionals and volunteers, but it is that message about keeping it simple. We overcomplicate it sometimes unnecessarily, but at the same time, it's also recognising that things can go and do go badly wrong for people at the end of life. But there are also those great stories which change the way that we look at death, dying and bereavement. So there are lots of ways. We've got the evidence to demonstrate that actually some of the strategies we've undertaken have made a difference, from that hub approach as we are as a network and engaging with a range of people across the board really, to make that difference in terms of the personal experience for people and that real opportunity that therein lies within those communities. And for me, I would say the last couple of years, longer than that probably, that is ever more pressing for me, that I feel so strongly about it, that for all of us it's not just a job, but it's actually how can we influence this outside of my end-of-life care role, lead role. Actually, I've got lots of opportunities lots of people I can reach within my circle of family and friends.